Okay, this is the 8th and the last session in prostate cancer station, okay, in pathology, okay, for the MRCS Part B examination. So now the examiner is going to ask you two questions. These are the last two questions in most of the cases. And the first question will be, he's going to ask you, what is the idea in treating prostate cancer by bilateral orchidectomy? Okay, what is the why? What is the mechanism here? Okay, fine. And your answer will be as follows. The sentence or the two words that you want to remember here is that you want to tell him that this is called androgen deprivation, okay, deprivation, okay, androgen deprivation. What you do in bilateral orchidectomy in prostate cancer is called androgen deprivation. In this way, he will know that you understand what are you talking about, okay. Then you are going to explain the mechanism or the algorithm by which this will work, okay. So you know that the survival of the prostate cancer cells is dependent on the androgens, okay. So you did a bilateral orchidectomy, okay. So what happens here is that this is the mechanism by which the cancerous cells increase, and this is why in some schools they remove the testicles, which is not a good idea, but they do, okay. So the androgens actually, okay, bind to these androgens, and the androgens bind to something called AR, and AR is an abbreviation for androgen receptor. These androgen receptors are on the cells, are on the prostate cells, okay. What happens when the androgens bind to androgen receptors? They do expression for some genes, and these genes are called pro-growth and pro-survival genes, okay. Again, what is the idea? It is called androgen deprivation. The growth and survival of the cancer cells depends on androgens. This is a very important information. You may know it already, but if you don't, please know it now, okay. So what you do is that how androgens act on cancer or increase it. The androgens bind to androgen receptors, and the androgen receptors lead to these receptors are on the cells of the prostate and in the cell inside by messengers and these things that you do not need to remember or know. There will be an expression or overexpression for the something called pro-growth and another thing called pro-survival genes. This is the mechanism by which the androgens actually enhance the cancerous cells to grow, okay. This is the first question finished. Let us go to the second question, which is a simple question, okay. And he is going to ask you that in the testicle, okay, which primary cells produce testosterone, okay, which cells produce testosterone in the testicle? And the answer here is Leydig cells, okay. Leydig cells are the cells responsible for the production of testosterone. In this way, this station has finished, and I will see you in another station later. Thank you very much.